My name is Georgia Roark. I am a fourth semester nursing student. Today is April 2nd, 2019, and it is about 9:50 in the morning, and today I'm going to be doing nasotracheal suctioning. So beforehand, I want to make sure that I have an order from the doctor to do this suctioning. I also want to check to see if my patient has any allergies, and then I also want to assess my patient thoroughly, check his vital signs, blood pressure, heart rate, especially his respirations, the pattern and rate of those, lung sounds, skin color, and if my patient is oriented and knows what's going on. And let's get started. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. I pulled my curtain when I came in for privacy. Mr. Jones, can you tell me your name and date of birth? Perfect. And do you have any allergies? Okay, good. Go ahead and put him up to a good working height. And I'd let him know the doctor ordered for me to do some suctioning, okay? It sounds like you're a little bit gurgly maybe. Put him up in the high Fowler's position. So, of course, I assess all the vital signs, but especially do lung sounds. So I listen to 6 quadrants in the front, 1 here, 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 and here. 2 on this side and 2 on this side. And then I'd also make sure to listen to 8 posteriorly. So I'm gonna go ahead and get this out of my way because I'm not gonna need it. Okay, so I'm gonna go ahead and put on my clean gloves. So I'm going to go ahead and hyperoxygenate my patient. Depending on how much oxygen he's on, I'm going to turn that up. And then I'm also going to turn this on and get my tubing ready here. Turn it up. I want it to be between 80 and 120 when I'm including the hole, the tubing, and it is, so we're good there. Let's go ahead and set this and have it ready. Hygiene. Mr. Jones, are you comfortable like that? Good. Okay, so if my patient was not conscious, we'd have him laying on his side, close, looking towards me. Okay, I'm gonna go ahead and put a towel on him. Perfect. Okay, I'm gonna go ahead and get these out of my way for the time being. And I'm gonna go ahead and dip my solution here. Perfect. Okay, then I'm gonna go ahead and open my sterile kit to get my Okay, I'm going to touch just the bottom of this and get it ready. I'm going to pour about 6 inches away. Perfect. I can go ahead and put this back on. Okay, so now I'm ready to go ahead and get my sterile gloves on. So with my sterile gloves and my kit, I want to make sure beforehand that they are not expired or haven't been tampered with. They have not, so that's good. So I'm going to go ahead. Also, my patient does not have any latex allergies. And this time I'd also put on a gown and face shield if needed, but for the purpose of this video, I'm not, so you can understand me as I talk you through it. Okay, so I'm going to do my dominant hand first. Perfect. Okay, so now I'm ready to go ahead and get my tubing out. Okay, so before I do anything, I want to make sure and measure to see how far I'm going to be going in. So I'm going to do from nose to ear, and then from ear down to the neck. So I'm going to go about 8 or 19 is where I have mine at. Okay, so now I'm ready to break sterility because this hand is no longer going to be sterile. So I'm going to go ahead and hook up my tubing here. Let's go under here. Okay, hook this up. Okay, so then I'm going to test it. Okay, make sure it works. So now I've also lubricated it while I tested it. So I'm ready to go ahead and go in. So I'm going to go ahead and remove my patient's oxygen, and I'm going to let him know what I'm doing, have him take some deep breaths. He's probably going to be doing a lot of coughing and choking as I'm doing it. So you do not want to have your finger on the hole as you go in. You're going to go in like so, towards the opposite side of the nose. Go in that 19 inches. Okay, and then you're going to hold this and you're going to twist and pull it out. Okay, and I'm going to go ahead and get this lubricated and clean it out. I'm going to go ahead and put his oxygen back on him, let him recover for about 30 seconds. I also want to encourage him to take some deep breaths and do some coughing in between suctioning. So you want to make sure, Mr. Jones, sorry about that, that you want to make sure that you're not in there suctioning any more than 15 seconds, and this whole procedure should not take more than 5 minutes, because then it could be dangerous. So we're going to go ahead and go again, lubricate this just again, clean it out. Okay, Mr. Jones, we're going to go in a second time, okay? All right, here we go. Feed it in there real quick. Okay, and then you're going to suction and twist this as you're coming out, making sure not to contaminate. Clean it out. I'm going to go ahead and put his oxygen back on him. So I'd assess to see if he needs it a third time, but he does not, so we are good. So I can go ahead, clean this out a little bit more. Okay, and I can wrap this up in my gloved hand. Go underneath here and hang this. And I would change this out every 24 hours if needed, or if it's full. Go ahead and wrap this up in my hand and dispose of these. There we go. Hand hygiene. I want to make sure to turn my suctioning off. Turn it off, and then I want to put my oxygen back down to a normal for him, what he had it at. Okay, so I'm going to go ahead and take this off of him. I'm going to clean up my workspace here, throw everything away that needs to be, and I would get my patient back in a good position, and I would want to reassess my patient, see if the vital signs have changed, the oxygenation is better, his respirations, and I want to go ahead and go out and document this. And I'm going to document the type of tubing used, how far I went in, how many times I suctioned, how my patient tolerated it, and then what I saw come out, the amount, the color, consistency, and the odor, and then also how my patient's vital signs were afterwards, respirations, and lung sounds, and oxygenation.